who can stand before him. When we call on that great name, somebody say Jesus, Jesus, Jesus. There is power in the name of Jesus. There is healing in the name of Jesus. There is victory in the name of Jesus. There is salvation in the name of Jesus. There is joy in the name of Jesus. Somebody say Jesus, 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 Jesus. Oh, glory, Jesus.
Good morning, family, friends, and followers. I know it's been a while since I have posted a longer length video, but just wanted to take a few moments to update you on how I'm doing. I have started endocrine therapy, which consists of a once daily pill, which is tamoxifen. It's a hormone blocker to pretty much cut off the production of my female hormones, which were feeding the cancer. This now with a goal of prevention for late stage recurrence. And then I've also started the monthly injection, which is a Lupron injection that I go into the cancer center to get once a month. And basically it just kind of finishes what the pill starts, and also blocks hormones and pretty much prevents cancer. So it's a part of the preventive strategy. The other updates I have, so I had my 6-month appointment with my breast surgeon. So this is the first of 4 appointments today. This is my follow-up, my 6-month follow-up with my breast surgeon. This afternoon, I also have 3 more appointments with my medical oncologist. The first will be for labs, second will be for, the actual consultation with my medical oncologist to see how I'm doing after chemo and radiation. And then the third appointment is for my infusion, my monthly injection. So right now with my breast surgeon, she's just checking my mastectomy sites for healing progress, checking in on just overall well-being. That went well, everything's healing well, and I'm on track to move forward with the final phase of this chapter, which is reconstructive surgery. I have a follow-up with my plastic surgeon in December, and we're hoping to stay on track with the surgery sometime in the end of the winter, early spring. So we'll know more after I have my follow-up. Then I also have had my follow-up with my medical oncologist to check in, see how I'm doing post-chemo, post-radiation, and during endocrine therapy. I have had a lot of joint pains, which is a side effect of the medications I'm on, as well as noticed some changes in my nails, skin and nail changes. Very similar to chemotherapy. My nails are like darkening, turning kind of a darkish purplish black, becoming really brittle. My energy kind of waxes and wanes, and I don't fully feel 100% still. Hoping to feel better at some point, but it seems like this is now the baseline normal on endocrine therapy. So I did talk with my doctor about managing these side effects, because the idea of feeling this way for the next 5 to 7 years is a bit daunting, and I want to be able to feel better and functional. And just thoughts or guidance, advice on managing joint pain. I feel it most in my knees, but also in my feet, arms, shoulders, just really kind of all over. It makes it really hard to stand up, sit down.
When did it start?
After I started tamoxifen.
Okay, so you noticed a clear trend?
Yes,
okay.
Definitely.
was to start that injection.
Okay.
Remember, Lupron
Yes.
is to shut off your ovaries.
Yes.
That too can cause joint pain and stiffness because
Okay.
essentially you're becoming postmenopausal.
Okay. I was going to ask what medication I was supposed to be getting. I couldn't remember the name. And
Yeah.
So Lupron. Okay.
Lupron.
Got
Yep.
it.
It's an injection into your bum.
Okay.
Once a month. And we'll sort of see how things go.
Okay.
But these medications can be a little bit annoying for patients because
Okay.
oftentimes joint pains, joint stiffness, sometimes you can have vaginal dryness, hot flashes.
Hot flashes have been ongoing. But they actually started since chemo.
Yeah.
I was doing acupuncture and they seemed to get better, and then I started radiation and they got worse. So then I started, my PCP put me on gabapentin.
Oh, yeah.
So then they got better, and then I think when I started tamoxifen, they got worse again.
Yeah.
And so my prescription for gabapentin was increased. So now I'm on like 300 milligrams of gabapentin.
That's exactly what we do here.
Okay.
Is get
So I have been going to physical therapy, and my physical therapist did notice that there was a significant reduced range of motion post radiation, and so we've been working primarily on range of motion exercises to restore that again. And he said that's pretty typical for cancer treatment. It ebbs and flows. You know, we'll make progress. I had moved on to, you know, some weight bearing and strengthening exercises, and now kind of a bit of a step back post radiation because of a lot of the tightening that has happened in my chest and muscles that have contracted as a result of radiation. So now working to loosen those up again. So there's that. So some of my new exercises for homework involve really just stretching and loosening that right shoulder, right chest wall, which has been impacted the most. Some other things, on the day that I had my follow-up with my breast surgeon, I also had the follow-up with the medical oncologist and got the Lupron injection. All of that, it was a day of marathon appointments, 4 appointments. So 9 to 5, and it was just a reminder that cancer is a full-time job. In fact, you know, balancing my cancer care or post-cancer care, maintenance care, with working full-time and managing a household, it's proving to be my new normal. Is just feeling sometimes overwhelming. It's a lot, and I sometimes feel like a double agent, you know, kind of living a double life. Like there's, you know, the working me that goes into work and tries to be as close to normal as possible, which I do have to advocate for some, you know, sometimes accommodations, sometimes some more flexibility. And I've got a great supportive team, thankfully. Hey there, logging in for a remote work meeting. I'm logging in from the Cancer Center, where I have several scans this morning. I had to come in for an 8:15 a.m. injection, and then I have a bone scan at 11:15 a.m. and then a bone density scan next door at Brigham and Women's at noon. So busy morning, and then I'll be working remotely this afternoon. But then there's the cancer side of me, or post-cancer side, that is going to medical appointments here and there and everywhere. So after the follow-up appointments, I did notice I was having some flank pain. Never knew what that was. I was trying to describe the pain to them, and as I said, it's like my lower left back. It's on the left-hand side. It's, you know, it's kind of like inside, but not like external back pain, but it feels like it's radiating in my back. They were like, oh, that's flank pain. Did some additional workups. They referred me to urgent care because they were concerned given my cancer history and now new pain. They always check for possible metastases. So they ran a lot of tests, did some scans. Thankfully, the scans came back clear, but they were non-contrasted scans, which I later found out they've referred me for additional scans that have contrast because those tell more of a story, give You can see that my hair is growing back. It's kind of sparse, a bit thinner, finer. It's a lot like baby hair. So it's really like starting all over again. You know, my maintenance regimen is using baby oil and baby shampoo because the hair is so fine and very different texture from what I had before. I've read a lot about chemo curls and heard that you know, the hair can come back a bit different. It sometimes is temporary, sometimes it's permanent. We won't know until we know, which is kind of the story of this whole journey. And I've learned to just be patient, accept what I can't change, and you know, change the things I can. And I've prayed for God to grant me the wisdom to know the difference. And I appreciate you being along with me on this journey. Thanks for your prayers and your love. Take care.